term representing Senate District 14. He's a ranking member of the Local Government Committee. He also serves on the Capital Development Committee and the Health Insurance Exchange Oversight Committee. Previously, he served on the Health and Human Services Committee, along with many others. He also served 3 terms as a state representative for House District 52. In the middle, we have Representative Landgraf. Is anyone here from El Paso County? Second. So Representative Landgraf serves House District 21, and she's the Minority Caucus Chair in the House. So thank you for being here. And last but not least, closest to me here, we have Representative Becker. So is anyone here from Boulder? I know there's people out there. Representative Becker focuses on public health and environment. She serves on the Finance, Capital Development, Agriculture, and Natural Resources Committees. And before being elected to this role at the state level, she spent several years on the City Council in Boulder and has done other planning activities. So thank you all for being here. And then ask them, instead of reading their bios, which are very impressive, and they're all on the website and their schedule, so if you'd like more details about anyone, please check those out. But I thought we'd get a little bit more of a kind of human face for our legislators, so I'm going to ask all 3 of them to explain what just briefly interests them about public health and its interaction with the law and legislation. So I'll start with Representative Becker, since I didn't see you last. Thank you.
Hi, thank you everyone for having me. I actually represent 5 counties, Boulder, Gilpin, Clear Creek, Grand, and Jackson County. So if any of you from any of those counties, thanks for being here and thanks for letting me represent you, because it's a real honor. So my background is actually as an environmental lawyer, and one of the things I love about public health issues are just the intersections it has with so many other fields. Health, obviously, environment is another. As a mother with 2 little wild boys at home, ages 4 and 7, and as a daughter who's dealing with a sick mom, you just find that your personal interests can really coincide with your legislative interests. My personal interest with my legislative interests, because it's so much of what I'm doing in my personal life and then previously in my professional life, working on environmental issues. And so I'm really glad to be here. I love working on these issues, and I look forward to this discussion.
Good morning, it's nice to be here. It's an honor to have been invited. I think my interest in public health probably started when I was asked to play a very important role in starting the cardiovascular health research unit in Washington at the University of Washington Medical Center. And all the research that was being done was really on, I would say, public health, environmental issues as it concerns cardiovascular health. For instance, is salmon really good for you? And I can tell you that yes, it really is. It does reduce cardiovascular disease. But who knew until they actually did a study? So we did a lot of things like that. And then when I was elected, I was assigned to the Public Health Committee, where I'm ranking member. I am on the other health committee also, so I kind of get it both directions. I've enjoyed running some public health bills because I think those are issues that do impact all of us. And I can tell you that I get a lot of that advice from my daughter, who happens to be a physician's assistant at Memorial Hospital. And she'll come home and say, we're seeing this trend. And then I'll do some research on that trend, and sure enough, it's a problem. So that's kind of my background and how my interest in public health. Thank you.
Thank you, Lois, and thank you all for inviting us and allowing us to be here with you to have a good dialogue on really important issues. The turnout here is spectacular, and while I haven't attended many of the sessions, or actually I haven't attended any of the sessions, got here yesterday with my wife. It's always nice to be up in the mountains, and I think we can all agree that that's a very good important public health practice, and that is to get outside as much as possible. In terms of my interest, I don't know, I suppose it goes back to, I graduated from CSU in 1978, and one of the things that I did upon graduation is I was in the Peace Corps, and I served as a agricultural extension worker in El Salvador in Central America back at a time when it was very difficult down there. So I got to see a lot of things that really opened up my eyes. And when I came back to America, I mostly worked in the human service arena, doing direct services and a variety of other things, public policy work. But one of the jobs I had back in 1987 was actually Abby Strand, some of you know Abby Strand hired me back in 1987. I was the migrant health outreach worker for the summer, and that really exposed me to some of the issues that those folks are facing. But in general, in the legislature in the last 9 years, I've served on the Health and Human Services committees, and we've addressed a lot of issues, and of course this past year I've been on the local government committee, and it's still important to me. So I think a lifetime of activity and also the work that we've done in Health and Human Services in the legislature are things that inspire me to continue working on these issues.
Thank you. Representative Wagner, I'll start with you so that you get to go first as well. In the past year, or more than last year, we were working on some design and drug efforts, as well as respite for caregivers and addressing some of the challenges that they face. So perhaps you give us a little bit of background on the work that you've done and then what you hope to achieve will be coming up.
Well, the designer drug bill was the one that I did it for my daughter. It came about in somewhat of an odd way. She started talking to me about a patient not violating any HIPAA rules, but she would say that she had yet another patient who came in and he was in a coma, or she passed away, and ultimately it would find out that this person had taken the drug Spice. At the same time, I was invited to I'm not sure you can hear me. At the same time, I was invited to a presentation by a pharmacy student who was shadowing her, and she did a presentation on Spice, the dangers of it, and the fact that it is almost undetectable when it's sold in stores, that you can't go in and, like some drugs, easily identify it. So stores would get away with selling it. By stores, I mean usually 7-Eleven, because that's like a brand, and I'm not implying that they did it, but that type of store, convenience stores, would sell these products at the counter, and they were marked with symbols like Scooby-Doo, because they have a variety of names, so you can see a little package with Scooby-Doo the dog, and what kid doesn't want to buy something that has Scooby-Doo on it? So these things were very, very dangerous. Also at the same time, we started seeing drug busts. We had one in Colorado Springs. They confiscated thousands of pounds of this product that was going to be packaged and sold, and the people got off with a very little penalty. Again, because it's very hard to track it back, figure out what they're doing. So this bill, because it was already against the law to sell it, but you have to identify it, you have to be able to do something before you can penalize somebody. So this bill makes it a deceptive practice, so that if somebody is selling Spice, they can no longer say, I didn't know what it was. I didn't know what was in the package. If it's in the store and they're selling it, they're in trouble. And we've had quite a few successes as a result of that. And also as a result of that, I was offered to my county the first synthetic drug dog that was trained in Georgia, which is fabulous. So that was a real success, I felt. And then last year I did run a respite care task force bill, and they're going strong, they're meeting regularly, and that bill is designed to figure out what we need to do with respite care. So if you know anybody who is elderly, disabled, they have a chronic illness, anybody that needs care from a caregiver, it's very hard to identify caregivers, it's very hard to fund caregivers, it's very hard to get licensed if you are want to be a center I decided that we would have a task force that would look into all of this and determine what really needs to be done, because every person I talk to, depending on where they were in the spectrum of either providers or users or somewhere in between, everybody had a different idea what needed to be fixed. And when you hear 30 different ideas that need to be fixed, you kind of have to pull it all together and start prioritizing and figure out, if we fix this, does it also fix that? So that group is going. I am going to have to run a bill to get an extension. It will have to be an early bill, and just have to hope that it goes through, because they're supposed to be done with their work in January. And because of delays in putting the group together, and it's just, these things take time. So that'll be actually a bill that will be run right off the bat. And any legislation that comes out of that, any suggestions they have when they figure out what we need to fix. So those are a couple things that I ran a bill on. And then another bill that I'm really excited about that I just filed, and that's going to be a PTSD dog train the trainer bill. Through one of the bills I ran last year that provides ongoing support to veterans who go through a workforce development program, giving them follow-along services. Working with those vets, I realized that some of them have PTSD dogs. And then my research showed me that many vets who have PTSD, they're afraid to come forward and do what they need to do to get the services they need. And that includes reaching out to get the dog. And these dogs literally save their lives. So to try to allow vets to get dogs without a stigma of a mental health need. I've been working with some people, and we thought that the best way to approach this is to develop a program where the vet can go and learn how to train a dog, learn how to recognize a dog that will work for them as a service dog, and go through the process, get the training, get the certification, without having to reach out to the VA to say, I have a need. So I'm hoping, it's in very early stages, but I do have a drafter, and I'm just really excited about this. And these dogs, if you see a veteran with a PTSD dog and watch how that dog reacts with that person, and they have special training. When I met, would stand behind his soldier, so that if somebody came up from behind, the dog was there, and he could feel the dog, and he knew that the dog was protecting him, and that he was safe. So even if somebody was there, that person was not a threat. This particular man has terrible dreams, nightmares. The dog will climb up over him to anchor him to the bed and give him that kind of comfort and protection. That kind of thing, and he admitted the dog has saved him from committing suicide many times. And we know that the suicide rate amongst veterans is over 20 vets a day nationwide commit suicide. So I think anything we can do in Colorado to reduce that is would just be phenomenal.
That's also to do with great initiatives, so excited to hear more about that in the future. Senator Falls, you briefly spoke in your introduction about your background in human services, and I was hoping you could kind of expand on your efforts to eliminate health disparities, especially in your efforts to do poverty reduction work that translates into better health.
Certainly. Thank you, Kristen. I presume folks can hear me right. As I indicated, I've been in the legislature for 9 years now. It's been a heck of a journey, let me tell you. But overall, it's been very good. It's not easy work. One of the take-homes that I want to leave with you, and I will answer the question, is the notion that public policy, whether it's public health policy or whatever kind of policy, social welfare policy, it's really important. And I think that's one of the themes of this conference, is that we connect the dots. Historically, we've done things too much in silos, and so I think we're getting better at that. So I think that's one thing I'd fight community force, but also on the issue of public policy, I often say to folks that it's basically a reflection of the values and priorities of those who participate. So if folks like you participate more, then you're likely to see some of the best practices and some of the policies that you think are effective in bringing about change and helping to ensure that we are addressing healthcare disparities and creating greater health equity. In response to the question, one of my claims to fame in the legislature is that I ran a bill back in 2009, 1014 or something, 1064, House Bill 09-1064, which established the Economic Opportunity Poverty Reduction Task Force. And we were set up as an interim committee for 5 years. And I think overall we did good work. Each year we had to go back and get our status approved, and there were times we had to operate as an ad hoc group. But I think overall we had success in reframing the issues of economic opportunity and poverty reduction. That it's not necessarily about more government programs necessarily, but it is about retooling our safety net system so that it's as effective as possible. But it's also about helping the business community in particular understand that this is not a Republican Democratic thing, it's really a people thing. And if we can do a better job of addressing poverty and expanding economic opportunity, so many families, right, they're living paycheck to paycheck, even though they're working hard, but sometimes the salaries are not able to keep up with the expenses, healthcare expenses, childcare expenses, and all of that. So I think overall, I can go through a litany of things that we were successful in terms of passing bills into law that relate to expanding the child care assistance program and improving quality aspects of it, to the property tax rebate program, which is something that helps, in particular, seniors to offset some of their costs, to aid to median disabled program, a variety of things. But I guess one of the things that I'll close on this question is that I'm perhaps most excited about it. Maybe there's not total agreement, although the evidence is there that it's very effective for eliminating or reducing childhood poverty, is the earnings tax credit. So I think most of you know that there's a federal EITC that is basically putting money back into people's pockets. They have to work. They typically have children. They have to have children. And depending on the family composition and how much money they work, they actually get a refund from the feds. It was established back in 1975. It's historically had bipartisan support, and it's proven to be one of the most effective tools for addressing particularly childhood poverty. At the state level, we've had an EITC, which was established back in 1999 by some colleagues back then. And over the years, well, it was basically kind of morphed into a TABOR refund mechanism. And therefore, it was only applicable when we were exceeding TABOR revenue limits and so on and so forth. In 2013, we passed the Working Families Economic Opportunity Act, and that basically said that once we reached the TABOR threshold, this thing would trigger on. It was the only really TABOR refund mechanism left. There was about 16 of them, 13 of them at one point. So once we reach the threshold, we're over the limit, and we have to start refunding money back to everyone in general, and we've reached that point, by the way. The EITC would trigger on, and after the first year, it would become part of our tax code. And again, there may not be total agreement on this, but I would submit that if you're a family and you're getting $4,000 in a refund from the feds, the way the state EITC would work is you get 10% from the state. It has a price tag, there's a fiscal impact, but in the end, that's $400 more in people's pockets. And if you're living paycheck to paycheck and you're trying to make sure that your kids are as healthy as possible, going to school or getting access to quality child care or preschool, then that money actually, I think, is significant. So I think that's what I'd like to begin with. That's my response to your question.
Great, thank you. Representative Becker, you were involved in 3 specific 2015 bills that our CPA members are very interested in hearing a little bit about what happened as they moved through the process, as well as what's in their future. So those bills, I don't have the numbers memorized, but just casually, the LARC bill, the restaurant fee bill, and a tobacco cessation age restriction bill.
Yeah, not age restriction, actually just licensing.
Licensing bill. So if you can give us a little backstory and maybe where you see that headed next year.
Sure. And there's a common theme for me me in all of these, which is just common sense. I think all of these are real common sense bills, so I'll probably talk a lot about that overall. Mark, I think everyone knows about that bill, long-acting reversible contraception. I think you all know the story. A private foundation had come to Colorado and funded Lark for several years and saw great successes in decreasing the number of unwanted pregnancies, teen pregnancy rate, the number of abortions in the state. And they said, we've proven that this could be a success, and now it's time for the state to take it over. And that's typical for foundations. They'll work on something for a few years and then move on and hope that it gets legs somewhere else. So we have a state statute that says anything previously funded with gifts, grants, and donations, which this was, cannot be funded by the general fund, the state general fund, without a separate authorization from the legislature. So then to fund this, we thought we had to run it as a separate bill. We ran it as a bill. We had bipartisan support in the House. We had just dozens and dozens and dozens of organizations register support for it. Lots of grassroots work, because people understand the value of this to Colorado as a state, because it decreases costs to the state, not only for Medicaid, but for WIC costs, women and children, TANF costs, costs to counties in the state if children are having children and they're not ready to have those babies. There's a cost to the state in terms of other human services. And so a lot of people supported it for that. They saw the support that it provided for teenagers and other young women who are likely to stay in school longer. So we had good bipartisan support in the House, but there were questions about, well, what's the role of government here? And I would submit that the role of government is always to look at our budget and to always find ways to be more, to find ways to decrease costs. And this showed such huge savings to the cost with the most conservative estimates, which didn't account for things like TANF and WIC. We determined that for every dollar the state spent, it saved the state $5.85 just in terms of Medicare. And it also, a high school dropout and giving people the best earning potential by staying in school longer is absolutely a state interest. So that's why should the state take this up? Some people were concerned about would it lead to promiscuity in where there shouldn't be, where in youth where they should be not thinking about sex but other things. And I think one good response to that was, it's happening anyway. Another is that actually the evidence shows that there were not increases for STDs or other rates of teen engagement in sex because of these programs. So that was another response. And then another concern folks had was, well, doesn't Obamacare already take care of this? So besides the fact that I think it's interesting to say, does Obamacare take care of this at the same time that you're trying to get rid of Obamacare? But Obamacare eventually will get there, we think, we hope. But a lot of insurance plans are exempted out of this. They're grandfathered out. A lot of people still aren't covered. A lot of clinics don't actually carry LARC now because it's new. It's something they have been doing for a long time, and it's expensive. So having a push to get it in more clinics is a good thing. There are lots of reasons that for now those insurance plans really aren't addressing the need. The ultimate desire is that absolutely these will be covered in insurance and everyone will be covered by insurance, but we are not there yet. So this bill is really intended to was intended to provide some gap funding until we see greater coverage and response by the private sector in really carrying work. So we had the bill passed through the House. It died in the Senate in the Kill Committee. Since then, I went back to legislative legal services. We don't have a lot of we don't really have personal staff at all as legislators, but there's a set of lawyers that work at the Capitol. They're nonpartisan. And I went back to them and I said, do we really need to have a bill for this? Because if we can run it through the budget, then it's really not as political of a thing. And we can, maybe have better chances of bipartisan success in the Senate. And they don't often go back on their legal opinions, and they looked into it and they said, actually, this plan, the state has been funding contraception and even long-acting reversible contraception for a long time, and therefore it's not a new program that was funded solely through gifts, grants, and donations, and that therefore you don't need a separate bill to run this, and then if the agency, CDPG, wants to run it just to submit a budget item, they will be able to do that. So that would be up to CDPG and really the governor's office to decide if they want to submit that as a budget item. But that legal opinion is huge. Really a game changer for LARC because it just makes it less controversial, less out in the forefront. It's great that this bill and this effort got such huge national attention. Many other states are looking at this. Newspapers from the New York Times and Washington Post and magazines from the New Republican, Mother Jones, and conservative and liberal magazines all covered this, and so it's getting a lot of national attention. Ultimately, like I said, I think insurance will cover this. I think another long-term solution we see in this regard is companies and organizations are really trying to decrease the cost of LARC overall, and that's really where I see this headed in the long term, that it won't be a big state burden, because as they develop less expensive products that women can use that provide long-term contraception, that will really solve a huge problem in terms of funding. So that's the LARC bill. Happy to answer any questions. The other one that I worked on quite a bit was the fees for restaurants. Your wonderful lobbyist, Jennifer Miles, came to me and said, do you want to work on this? And fee bills, I'll tell you right now, are not popular bills to run in the legislature, because, and what this bill does is it would increase the fees that restaurants and other grocery stores and 7-Elevens and things like that get charged for the state or the local public health officials to come in and inspect the restaurants. And they hadn't been increased for 6 years, and there was a gentleman's agreement, I guess 6 or 7 years ago, that said, let's look at upping these fees every 5 years, because that's what's fair to the local public health officials to meet the costs of doing this and of inflation. And so when it came time to start that process, okay, it's time to increase fees, and those fees are increased through the legislature. A lot of different fees that are set in the state do not go through the legislature. This is one of them that is set by the legislature. And the Restaurant Association didn't want to engage in a conversation about it because one county in particular was using a grading system on the restaurants that they didn't like. So efforts to really work with the stakeholders on a bill to address fees died right off the bat. And so what we did is introduce a bill that said we're going to move the fees from the legislature actually to the Department of the Public Health Board. And that way they don't have to go through the legislature every time. And the public health boards are actually much more logic-based than the legislature, which is a very political-based organization. You know, the Board of Health would look at the actual costs, actual impacts, and make more of a policy decision than a political decision. And we heard support for that initially because, frankly, it's easier for some legislators to vote for moving the fee to a board than to actually vote for fee increase. Because fee, no one likes to have to pay more to the government. So that was the approach we started with. It definitely got the attention of the stakeholders, and they said, wait, let's all sit down together and start talking about fee increases. Ultimately, what we ended up with is a bill that said, let's create a stakeholder process where we'll talk about the fee increases, because all parties have a legitimate concern. The restaurants are concerned about their fees, but the public health officials, the counties that have to pay for this, this is a serious impact to their budgets. And the public expects restaurants to be safe and clean and inspected. And if they aren't, it hurts the restaurants and it hurts the counties doing it. And it's our responsibility as public officials to make sure that the food that is being served in our counties is safe and healthy, and is meeting all the requirements that it needs to be. And so the Restaurant Association and all the stakeholders have been sitting together in a very, very good process that CDPHE is doing, I think, a very good job of managing, to say what are the real costs and what's reasonable, what does the restaurants need out of this process. They really want uniformity, and then what do the public health officials need, and they just want to not have to be subsidizing these inspections as much as they are. So I'm confident that that's going to result in a good compromise, and that we'll be able to bring a bill this next session regarding restaurant inspection fees. The difficulty is we can have all parties agreeing, and I hope that's where we get, and it still may not pass, because there is just reluctance for some legislators to ever vote for anything, no matter who agrees to it, that increases fees for any industry. So we'll see how that goes. The other bill I'm really passionate about was an effort, bipartisan effort to allow local governments to license cigarette retailers if they choose. So right now, local governments can license anyone if they're selling tobacco or e-cigarettes, but not cigarettes. And it's because the cigarette industry back in the early 80s got an exemption. A specific exemption that says local governments may not regulate or license cigarette retailers. So why in the world, when we know that this is one of the biggest public health issues we have, do we have this exemption out there? When we are a local control state, supposedly. So why do we care if local governments can license cigarette retailers? Well, you find that that the enforcement of cigarette sales to minors is much greater when local government is involved. When it's all left to the state level, there's very few inspections, there's very little enforcement of those inspections, there's very little awareness of what's happening in any particular community about where cigarettes are being sold and who they're being sold to. And if you're 16 and you want to smoke, you're going to find out pretty fast what the places are that sell to minors. And we had testimony from some youth from Greeley who testified exactly to that. Everyone knows exactly where to go, and that's where they get their cigarettes, and you can be 13 or 14 or 15, 16, 17, walk in there and get your cigarettes, and they don't ID you. And that is a major public health issue, because if you start that young, you're going to keep smoking, and you're eventually going to cause costs to the state because you're a smoker. And you're going to end up with a lot of health bills that other people are subsidizing. And you're going to be contributing to secondhand smoke and all sorts of problems. So we just wanted local licensing. The state doesn't actually have any list of who sells cigarettes in the state. They have no idea. So although they're empowered to do inspections, they just have to take a good guess about where they should be inspecting. That's a problem. They, because there are no licensing, there are no fees associated with that, so they're a very underfunded agency. And the other issue is because there's no licensing, there's no license for them to ever take away. So you could get a violation after violation after violation after violation after violation, and nothing happens to you except fines, which are the cost of doing business for some of these places that sell to minors. So, you know, my mom was a smoker for 50 years up until she had her first stroke, and they wouldn't give her cigarettes in the hospital. And so then she had no choice but to quit smoking. And she was just diagnosed with lung cancer about 2 months ago. So this is something I'm passionate about. It's another one of those common sense things that there are huge costs and impacts to individuals and to the state because other people don't see their own behaviors impacting anyone else when in fact it really does. So I'm not sure if we're going to, we had bipartisan support. I sponsored that with Kevin PHiR, who's a Republican in Adams County. We'll see what we'll do this year. I know there are other topics coming up about you know, e-cigarettes and other issues around youth smoking cigarettes. So, so I'm not sure if we're going to do that again this year or not. But those are kind of three. I just want to mention one other. I worked on a pesticide bill. I really angered some people, and I said that on this pesticide advisory committee, we had to have public health officials on there, and we had to have an organic grower and a beekeeper. And because people just don't often think of some of these issues as having public health impacts. And they really do, and I think that public health officials will have a lot of good input to say pesticides aren't only about ag, they're also about public health. And so that's something else I did this year that I'm pretty proud of.
Thank you. So now we get to what's usually the audience's favorite part of these discussions. And sometimes the panelists get a little bit nervous, but we're going to do these questions and kind of get some audience engagement. And because I'm moderator, I get to have the first question. Please start thinking of what you would like to ask if you haven't already. If all of you could tell the audience here what you think the best way for CPHA members to serve as resources for you in your legislative work is, what's the best way for the people sitting in this room to engage with you and share their public health knowledge and expertise and sometimes concerns? So I'll start with your thoughts.
Thank you, Kristen. As one who, in addition to being a state senator, is an adjunct faculty member at Colorado State University, I teach public policy analysis courses to graduate social work students. One of the things that I try and impart with them is the importance of building relationships. So in the beginning of the semester, I often have them do an exercise to let me know who their state senator is, who their state representative is, and some interesting things about them and what committees they're on and so forth. And when I offer that assignment, it's interesting that very few know who their electeds are. And so that would be step one. Is I have a feeling you folks know, but I'm not going to make any assumptions. I've learned that you want to be mindful of making assumptions. But it's important to know who your electeds are at the different levels of government. And it's also important to build relationships, and not necessarily in the intensity of the session, when oftentimes we have bills and things are moving rather quickly, and it just gets really crazy sometimes. It's important during the interim, like now, like in the summertime, especially at the state level. You know, we're all regular folks. We're part-time citizen legislators, and we have our own values and priorities and how we see the world. So building those relationships, I think, is critical. And if you call up one of us, 99% of the time, we'll find the time to have a cup of coffee and talk about what's important to you. And since you also have the expertise, that can help us. That can help us to make informed decisions when we're dealing with some pretty complicated stuff down there. that involves a lot of stakeholders, a lot of perspectives, a lot of points of view. So that would be an important thing.
I'm sorry, what was the question? Apologize.
Sure, the question is, what's the best way for CPHA members to either serve as a resource for you or interact with you so that you have these relationships and you can be resourced for legislative session?
To me, the absolute best way is to call, have a meeting. I meet with people every single day that have an issue. I think every bill I've run to date has come to me from somebody who said, this is a problem, it's a big problem. I just heard about CCC and putting that behind the counter. So I heard that from one person. I've gone to other people to see if it truly is a problem. It sounds like it is a problem. And I think somebody, that may not be me, but somebody will be running the bill to put that product behind the counter. Because we don't want children overdosing. I see people are like, what the heck is CCC? CCC is a product found in a lot of cough syrups. And kids can, you can buy this in your drugstore. And kids are using this to get high or to get whatever they're using it for, and overdosing on it. So, like so many products, they're a good product, they're well-intentioned, they're there for the right reason, and somebody finds a way to use it incorrectly. But all of these issues work. I mean, I live in El Paso County. I certainly don't know what goes on around the state. I certainly don't know what goes on. I have a grandson in kindergarten, but other than that, I have not had children in schools in Colorado because we moved here after they graduated. So I don't know all the issues. I don't even come close to knowing hardly any of the issues. They all come from people like you, from just regular old folks who come up with an idea that this is not a good idea. I mean, this is happening. I was just asked about radon, because apparently when you have your new windows put in, it can create a problem, because now your house is tighter, I guess. It can create a problem with radon in your house, with who knew? So somebody mentioned that, and they would like just a check off on your contract when you buy windows that says you should probably have your house tested. I mean, I didn't have a clue. And some of the people I talked to, didn't like it. So reach out. And you don't have to just talk to, you can go through the list and find people who are on the committees that might be beneficial, or reach out to your own representatives or senators, or just anybody, because any of those people should respond to you and should at least send you in the right direction.
I'm just going to say, there are probably close to 700 bills that are run every year through the legislature. I don't read half of those. I read the ones in my committees and the ones I'm sponsoring. And even that may be more than what most legislators do, because there's way too much going on. So if someone else doesn't draw my attention to a particular issue or bill, I'm going to have no idea about it really. So if you are concerned about something, you have to speak up. And I'll tell you, I can't answer the phone when we're in the legislative session, but I read every email. So sending emails are great. Do it in your personal capacity if you can. Do it in your professional capacity if you can. I also think that personal emails are better than form emails. Those are just someone clicks a button and you sign your name. Those really are not as compelling to me. I'd also say short emails are good.
Looking out the audience, how many of you have sent an email to a state representative or senator? How many of you have called them on the phone? A lot. How many of you have met with one face to face? Wow, they were great. All right, we'll also keep doing that. So now we have some time to have some audience questions. We have some very questions.
Thank you. I want to thank all of you for your work in public health. First of all, in PC we've met. I'm with Florida County Public Health. And Senator Pauls, who's also met, you supported the VITAS program for health equity among diabetes disparities. And this is a question that I really don't know very much about, so I just want to find out what's happening in this arena. Is in terms of local control and jurisdictions having the ability to set living wages within each of their jurisdictions, similar to what has happened in Portland and other cities that have a really high cost of living. I'm curious if there's been any movement for local control for wage or living wages within communities in Colorado. Because it's interesting, again, for a city of Colorado that we don't have control over that. As a representative from an expensive place to live, and also related to poverty reduction, looking kind of at the root cause of some of the drivers of poverty.
Thank you. What's your name? Thank you for the question. I'll try to be succinct. It's obviously very important. There are often not simple answers. First of all, has there been movement on the issue of perhaps allowing local jurisdictions to implement minimum wage laws, increasing the minimum wage? There were two bills in the last session. One of them would have granted the authority for local jurisdictions to make those kinds of decisions. That bill was unsuccessful. It was a House bill. I can't exactly remember the House Bill 15, was it 1100 or something. And so there was one bill. So there was a movement this last session. That will be something that will probably be revisited. There was also I think it would have to have been a concurrent resolution to allow, to refer something to the voters. I think you folks know that when the stuff gets on the ballot, especially on the statewide ballot, it can either be a referendum, therefore referred by us, the legislature, or it can be a citizen initiative, like there are various efforts right now to put some interesting ballot measures on the November 2016 ballot. So there was a concurrent resolution that would have put to the voters a question about increasing the statewide minimum wage over a period of years. That was also unsuccessful. By way of background, very quickly, and then I'll try to touch on the other part of your question. It's interesting, and there's a take-home message here as well. The reason that we had to refer something to the voters in order to try and increase the statewide minimum wage is because it turns out that there's something in the Colorado Constitution, fiscal policy. There are lots of things in the Colorado Constitution that perhaps shouldn't be there. But back in, and I was actually involved in this, and this brings up the issue of language and unintended consequences. So back in the day when I worked for something called the Colorado Progressive Coalition, we were instrumental in putting on the ballot a measure that increased the minimum wage in 2008 or 07. It basically, the language was very simple, but it allowed him to go from $6.75, I think it was. It basically raised the minimum wage, and then it allowed it to increase. It allowed it to be increased based on the rate of inflation. So it set up an inflationary index, and that's what we currently have on the books. But because of the language, when I checked with legal services, we cannot say the state, the minimum wage should be $10 an hour. It has to go to the voters because of the way the language is written in that constitutional amendment. So right now, the minimum wage in Colorado is $8.23 for wage workers, and again, it's indexed to inflation. Most of the time, it's gone up. There was at least 1 year where it dropped a little bit. So that's the issue of minimum wage. There has been movement, and there is some background that's important for folks to understand. The only thing I'll say about the cause of poverty, because if you all want to step outside, we can go sit out in the grass and we can have a teach-in. I'd be happy to do that. One important thing, and I think you folks know this, is that when we talk about poverty, it's complex, but there's also the distinction between this idea of generational poverty and what some refer to as situational poverty. So when we had the recession, where a lot of families and folks were impacted for all kinds of reasons, losing their jobs, there were a lot of folks that were thrust into poverty, and when they were middle class folks, upper middle class folks, and all of a sudden they lost their jobs, they couldn't pay their mortgage, and next thing you know, they were in pretty dire straits. That's an example of situational poverty, folks that have not really experienced that. And so the responses, the potential interventions on the part of the community, on the part of the public sector, on the part of the private sector, nonprofits, faith-based communities, those responses I think are different. And then you have this notion of generational poverty, where it's more ingrained and it's been passed on from generation to generation. One response to that, of course, is what a lot of us are pushing now at the Capitol, and I think there's generally bipartisan support, and this idea of a two-generational approach. And the two-generational approach is that you're making sure that the child and the children, especially if they're in the early ages of their development, and you all know, you're all health folks, you know that all the cognitive development that occurs from prenatal to, from before you're born to 5 years old to be ready for school, but making sure that those kids have access to quality care, if they have to be in child care, the whole kit and caboodle. And at the same time, the parents are getting the proper skills, education, post-secondary, on and on, in order to fully engage in the workforce. So that's the two-generation approach. And those are ways that we can break this, this cycle of poverty.
Hi, thank you for being here. We really appreciate the time you've given us when you're not in session. Your personal time is really meaningful to all of us. My name is Dawn James, and I'm from Carson County. I'm the Deputy Public Health Director there. My question is, I heard the message loud and clear that you're not the experts in everything, and that you can't possibly read every single bill or understand every single issue. So my question is, we pay lobbyists to bring information to you as an association, as CPHA or Public Health Nurse Association of Colorado, what have you. What other, besides lobbying, what other influences are there beyond our emails and phone calls when you're on the Hill and you have to make a vote? What sways you one way or the other in your decision? Is it partisanship? Is it really the issue? What is it that makes that determination? And how powerful are our lobbyists to you in bringing information to you?
Thank you for your question. I'm going to take that because I have firsthand, and I'll tell you why. When people come to testify, people who come to testify can make a huge, huge difference. And I'll give you an example. We had a transgender birth certificate bill this year. And I knew I would be a no vote. So during the day, in the morning, when they called me out of the floor to meet some of the people who were going to be testifying, transgender people. And I talked to them. I told everyone I talked to that I would be a no vote, that they shouldn't worry, that the bill would pass, because the Democrats have more members on the committee than the Republicans. And I told them that they were likely to hear some really bad stuff because of certain members. I figured some bad things would be said. And they asked me how they handled that. And I told them just try to ignore it, stick on topic, answer the questions, and try not to don't get dragged down to that level. And then we went to committee, and I listened. And I heard the pain in these people's voices. I heard what the parents, one man in particular who said he was absolutely against, anything like that. And then they had a child who was transgender, and they saw their child suffering. And I realized that it was not up to me to make decisions for people, that it's a personal choice, and I voted yes. And I don't regret my vote, but it's because I listened to testimony. So it's coming to committee, having people come to committee, and if you can, try to control anybody who shows up and testify. And that's a good thing, it can also be a bad thing, because you can run a bill where you're really trying to control the message. I ran a Born Alive bill, and that Born Alive bill protected a woman's right to an abortion. It did not touch abortion at all. All it said was if a baby is born alive as a result of a botched abortion, that baby would get simple care, that it had to be fed. I mean, if it was a healthy baby, it had to be cleaned and, given humanitarian care. And we had testimony, people came from Virginia, they came from Washington, D.C., professionals. We had a woman who was born alive, whose mother chose to keep her. Great testimony. And then we had the people show up and take the whole thing right down a hole that it was never meant to go in. We couldn't stop that. We had people that got on the abortion kick and took the bill in a different direction. Now, the bill died, and I'm bringing it back, and I think I have bipartisan support, I think. But, so coming, testifying, bringing people, we had another bill that would change the age of autism support. A woman came to my office, she brought her child. This child didn't seem to be autistic at all because he had received support and services very early in his life. He was, walking proof that this works. So that's how you really change things. You can't go to the floor, once the bill gets to the floor. But once the bill gets to the floor, it's pretty much, a done deal. It gets people ready. So show up, bring people, and make sure you know what those people are going to say.
If I may, just a quick response. I think that the person who made this, Representative Landgraf, at her office was probably a constituent of mine who was instrumental in helping to pass the autism treatment bill that we passed in the last legislative session. Here's a classic example of a mom who has a child, Craig, who was diagnosed on the spectrum, and they were in Utah, moved to Colorado. They thought they would get better insurance here in order to be able to receive applied behavior analysis therapy, which has proven to be very effective for a lot of kids as an early intervention. Anyway, there were issues with private health insurance and all that. But here's someone who came to me at a real issue. It felt like there was a proper role for state government. But she was also willing to do the homework. She was also willing to bring folks together, which also included lobbyists and folks who work for the ARCs of Flowery County and Colorado. And in the end, it was an amazing process. Ultimately, we were able to remove some restrictions. It'll take a little bit longer than we had hoped. There was logic for that. We engaged the commercial carriers, the insurance folks, and typically, when you're looking at eliminating some limits on necessary treatment, that doesn't go over well. But in the end, people like Carrie and her son Craig made an important case. They backed it up with empirical evidence. They shared incredible stories. And this bill, it blew my mind that it had pretty darn significant bipartisan support in both the Senate and the House. And it will take effect on January 1st of 2017 to give the insurance carriers time to resubmit plans next year. Every year they have to submit their insurance plans. But here's a classic example where it really does matter. And I really appreciate the comments that was made.
I think to the extent you have a concern, if you have a solution, that's even better. And I think one thing that Senator Fox was just saying is being really specific. So it's one thing to say, oh, we've got big budget issues. Okay, so what would you like me to do? I can't start from scratch and research that from the beginning. Come with some ideas and we'll see what we can get done. So make it really easy on the legislator to actually provide help.
Thank you. I want to say a huge thanks from CPHA, Senator Paulus, from Senator Landgraf,